For your listeners who've got ongoing pain, keep listening to other people, because sometimes something that the two of us may have said, someone else may say it in just the right way, that it lands properly, that it makes more sense. And often we need that in the face of ongoing pain. We need to hear things in multiple ways before we can sort of figure out how to use that information.
You were just listening to Neil Pearson. He's a physiotherapist in British Columbia, Canada, and he's going to be a guest presenter, an expert for the online Rethink Pain workshop on January 19th. He's going to be talking about yoga for people impacted by pain, giving some basics that you can start right away. So if you want to be a part of that, you can check out www.rethinkpainworkshop.com before January 19th to be a part of the live recording. Afterwards, you'll be able to access the recorded video. In this conversation today, Neil and I are going to be talking about many different things about pain education that are going to be beneficial if you're a health professional, but also some takeaways that if you're impacted by pain right now, you can start implementing into your life. We're also going to take a deep dive into yoga, how yoga differs for someone who's healthy versus someone who's impacted by pain. And you'll also learn about how, as a yoga therapist, you can assess and treat someone through a different framework. And I thought that was really fascinating. I'm so excited to share this conversation with you, and I hope you get a lot from it. But first, let's cue the music.
Welcome to the Rethink Pain Podcast, empowering mind, body, and spirit. And now your host. He brought his two cats, Bonnie and Clyde, and his dog Oscar to New Zealand from Canada, Daniel Degenhardt.
I have with me today Neil Pearson. I'm super excited to talk to him right now because he's one of my mentors within the pain education field for many years. And so thank you, Neil, for being here.
Oh, thanks, Daniel. It's great to be part of the new projects you're working on.
Thank you. Awesome. Well, I want to give a little bit of a background on who you are to get started. Okay. And Neil, you're a physiotherapist, an adjunct professor at the University of British Columbia, and certified yoga therapist. And I first reached out to you back in 2012-13 when I was a new grad physiotherapist, and I was working in Slave Lake, Alberta, and right. I was looking for some sort of pain education program to help some of the people in my area. So I reached out to you because I heard your name from some of the stuff in my master's degree in physio over at Dalhousie. So that's when I first reached out to you. And that was an amazing start of, I purchased the rights to your presentation, the Overcome Pain, Live Well Again. There we go. Right on. That's the one. And I put that on bi-weekly for almost 2.5 years. And our small little community of 6,000 people started to make little shifts in how that understanding of what pain was, how it worked, and what people could do about it. So that's what started that little fire that's now burned into a huge passion for me for providing this pain education. So first of all, just thank you for being there when I needed you right at that point.
Oh, you're welcome. Well, and as we talk about that, I think it's important to sort of step back to the people who've taught me. Now, I mean, I would always say that the people who taught me the most are the patients that I've worked with. But in terms of educating people about pain, really would have to go to Lorimer Moseley and David Butler. There was a time when Lorimer was showing up in Vancouver a bunch and just doing these little talks, talking about his new education. And there were a group of us who were trying to talk about this, but I think the way that he was presenting it and the way that he and David put it together, it shifted a whole lot. It brought a lot of information together that we hadn't been able to do before. So I'm always so happy to be able to share it. And I was thinking, man, if you're teaching that many times, you've been teaching this a lot.
Yeah, I think I counted up recently as I've given over 50 presentations on pain in some way, shape, or form over the last 5 or 6 years. So that's I'm quite proud of that number, but I can't wait till it gets to something like you or Lorimer Moseley and David Butler. They've done this kind of stuff thousands of times. So I'm happy with where I am right now, but I know there's still so much to learn But so when you were first learning this, was that when they were first coming out with the Explain Pain information?
Well, it was actually a little bit before. So my main interest in this whole area came up because patients kept on telling me stories that didn't match with what I learned in school.
Right.
And so this would have been in the mid and late 1980s. And like a lot of physical therapists, I was really focusing on the manual therapy, and that answered a lot of questions, for one segment of the population. But this other big segment, it provided some temporary solutions, but nothing was really fully making sense. And there really was just a textbook of pain. I think back then may have been the only textbook. So there were no courses on pain. And so it was just a matter of, over the years, trying to follow the research, talk to other people, and put it together. And by, I think, 1997 was the first time I ever actually taught a course on pain, but it was actually only like a 2 or 3 hour long workshop, trying to get people who were working in functional recovery programs to start to understand this pain thing. Because we were starting, the idea of sensitivity of the nervous system was coming up at that point. And actually what happened in 1999 was a guy named Mike Shacklock, who's a physiotherapist in New Zealand now. I don't know if you've met him yet, but he does a lot of work in neurodynamics. Now I'm saying that, I'm wondering, he may actually be in Australia, not New Zealand, but anyway, he's down closer to you. And so he was teaching courses around neurodynamics, and he still does. And in the midst of one of those courses, he gave us a couple hours sort of on these new ideas of sensitivity in terms of not mechanical sensitization, but more neurophysiological. And once again, it answered a bunch of questions that I hadn't found answers to yet. And then, so that was in 1999, and I can't remember the first time I heard Lorimer speak in Vancouver. It could have been 2000, 2001. It was really early on, right? I think it was really, because Explain Pain, I think, came out in, now I'm trying to remember, it might have been 2003.
I feel like 15 years ago might be about right. Yeah, so that would probably be 2003, somewhere in there.
And that's when Lorimer published all of a lot of his early research was 2002, 2003, 2004. There's a whole bunch of his studies then. So it's, there wasn't much when I started, but there's so much now. And I think it's so amazing is that you say 5 years into being a physio now?
Yeah.
And you've taught it that many times? Man, I was, 12 years into my career before I even did the first time.
Yeah. So, and I remember you helping me when you were because you were one of the founding chair of the Canadian Physiotherapy Pain Science Division. Mm-hmm. And it was from that position that you actually helped me get an article in it was about giving pain education as a new grad. And that was one of the first big kind of articles that I put out there to the world about how, as a new grad, you can teach this stuff. There's simple things that you can teach to patients and health professionals alike. I invited anybody who wanted to learn about it to come and check it out. And we did make some of those small shifts. And I was a new grad baby physio that I didn't know what I was doing, but I was just jumping in because I knew that there was a need for it. And that just developed into more and more of what's happening these days.
Yeah. Well, it's been 10 years since the Pain Science Division started.
10 years.
So that this actually 2019 is the official 10-year anniversary, which is pretty amazing. We've come a long way. But one of the interesting things I'm doing now too is mentoring healthcare people, yoga people, like yoga therapists, and one of the things I'm mentoring them in is doing pain education when you're not already the expert. And so by the time I was teaching it, there was a massive knowledge and years of being a physiotherapist already. And so teaching people like yourself who had never done it before has been really, really fun. And realizing that one of the things that makes it a lot easier is that you can start with saying, I've learned this information and it's really interesting and it's really complex, and I wanted to share it with you to see if I can help you, but understand, I'm not the expert. And so I know that there's going to be some things that I say that may not sound right. And if that happens, let me know. And so you have this very different sort of approach to the education. As opposed to me, when I'm standing up there, people sort of expect me to know it all. right? To have all the answers, which is always fun because there are lots of times in the midst of this education where we have to say we don't know, and we have to. I think that's another part of it that's around the pain that's so important, and I'm sure you've recognized this so much is if you can't be okay with uncertainty, it's really, really hard to work in this area. And that's not really what we learned in school, right? In school, we learned how to be definitive. Yes, it's this way, or no, it's this way. No, that's what that is, and that's what that is, and they're different, and here's how. But in this area of complex pain management, it's different from that.
Yeah, definitely. That always reminds me of one of my favorite quotes. Is from, he was a neuroscientist that was also an astronomer. And he said that we know more about the universe than we are our own brains. And with the brain-based kind of approaches that we're taking with pain management these days, that just shows how much more potential we have to improve and how much more we still have to learn. Like you're talking just a decade or two is when this stuff was actually coming into light, and how much improvements we've made in those people that we've been able to teach. But we're still, I think as a society, we're still going into a place where more and more people are getting complex and persistent pain. So the education is there to help, but it's not quite getting to the people who need it. So that's kind of what you're going in. And right now you're currently being hired from the Doctors of British Columbia to develop and implement post-licensure clinical pain management education. So you're on the front lines on getting this education to those health professionals to then teach it to people so that everybody has this basic understanding. Can you tell me a little bit more about that?
Yeah, well, it started about 4 or 5 years ago now. There was the Doctors of BC, which is the British Columbia Medical Association. They decided to create what they actually wanted to do is create leaders within the province we'd teach them a lot, and then they would go out and teach the people in their community or their region. And so I got invited in because there were some pain doctors who knew that to teach family practice doctors about this, that they needed to have expertise of a physical therapist, of a nurse, of a psychologist. I think we had an occupational therapist as well. So we were trying to get a team together to teach the family doctors all this information. And so it worked in some ways, but now we're sort of regrouping again because it didn't make as big of a change as we hoped. And so we continue to do this work of how do we provide the knowledge in a way that will provide solutions for family practice doctors. So some of the things we do is teach them about pain because, like most healthcare people, they haven't learned a lot about pain science. Mm-hmm. We talk to them some about the lived experience of pain because that's another piece that we don't talk a lot about in school. And then we talk to them a lot about pain management being this broad thing, but within it, there's medical interventions, which includes surgery, injections, and those things. Then there'd be the pharmacological part, and then there's all the non-pharmacological care. And doctors tend to have a pretty good idea of those things, but they don't know the evidence. They want to know what works for the long run and what works, and gives people temporary benefit that would help them get better if we put it together with other things. And what they also want to know is what can they start in their office. So that's a big part of what we're doing is teaching the doctors how to actually lead their patient in a calm breathing practice and giving them some basic science that they can pass on to their patients. Because of course, when the doctors came back to me and said, "Okay, Neil, so I got this guy in my office. He's got back pain. I've never met him before, and he's telling me how bad the back pain is, and he can't work and all this stuff." And I start to teach him this breathing technique, and he says something like, "Come on, doc, I came in here with a back problem, and you're telling me how to breathe?" Right? And so there's this issue of finding the right language, right? So the education that we do is how do we find ways to get people to understand in a brief interaction why it would be important to do something like calm breathing, right? But we're also asking them to shift around some of their other language. So one of the things we came to is if the doctor were to see someone with chronic pain, and they believe that the best thing as part of the person's pain management plan would be to provide the person with a prescription, whether it's opioid or not. If they're going to give a person a prescription, we ask them to write it up and then hold it in their hand and reach it out to the patient and say, this is to help you move better. And if this doesn't help you move better by next week, when I see you again, we're going to change this, or we're going to get you to see somebody like a physical therapist or a yoga teacher. And now in terms of the physical therapist and yoga teacher, we did that based on research. There's other people you could see, and you may not have those people in your community, but that was just an evidence-based thing. Because not that there's evidence that says the other stuff doesn't work. There's just the most evidence on those two particular things.
Yeah.
Anyway.
That reminded me of when you did presentation back, I can't even remember what it was, if it was the Canadian Physiotherapy Association in Banff, when I was watching one of your presentations, and you had said at that point, 4 or 5 years ago, that you had accidentally coined the term movement medication. That is not pain medication, it's movement medication. And
yeah, actually, I think it was movement pills, but yeah, same idea. Yeah.
Oh, I remember it as movement medication, but that's what I've been using for my patients.
Hey, man, that's what I said.
But it's so true. And the idea that you don't want to just stop the pain. You want to use that, have an intention, a reason for improving how you feel and changing the sensations in your body. If it's going to be to just sit on the couch and watch some TV, well, that's not a good enough reason for your brain to actually utilize that medication in a positive way. But if it's to allow you to sleep, which will help you heal, or to go out and hang with your friends, or go for a walk, then that movement medication, that movement pill is going to be much more effective.
Absolutely. And, it's one of the ways that we need to, as we are shifting what we do within the physical therapies, the idea of being able to, actually not just the physical therapies, the non-pharmacological therapies, is to be able to say that there are specific times when the intention is just to decrease the pain for the reasons you just said. But other times the point is to allow you to have less pain so you can do what you need to do to get better. Right? And do we have time for me to tell a little story about that?
Definitely, yeah.
Because and it's interesting, because for me, this is where this idea came from. So my first year of being a physical therapist, I was working in a general hospital. And one of the jobs that I had was to help people get up out of bed and do deep breathing and coughing after they had a surgery to their thorax. So it was actually what they're having was a cholecystectomy, or they're having their gallbladder taken out. But in the mid-1980s, most people who had that done, what they had to do is cut between the ribs and spread the ribs apart, go in and take the gallbladder out. Now they do it through little holes, right? So it's mostly like an arthroscopic kind of surgery. So after that surgery, because they had to do that to you and stitch you up afterwards and bandage you up, most people felt like if they moved the wrong way that they were going to pull themselves apart and sort of spill it. There was quite a fear thing around it. And so what would happen after the surgery is the doctor would prescribe an opioid-based medication for the patient, and the patient liked the doctor. And then the nurse would come in and give the patient the opioid medication to give them some pain relief, and the patient liked the nurse. And my job was to go in and get the person to take some deep breaths and to purposefully cough, right, to expand that sore rib cage and to purposely cough, and then get them out of bed and take them for a walk. And the patient didn't like me. And way back then, as a young physiotherapist, all I could think was the injustice of this, right? Why weren't they telling the patient that the reason that they were giving them the medication was so that they could do the things that I was going to get them to do so they wouldn't die? But they didn't tell them that. They told them that the medication was for pain, right? And so this sort of stuck in my mind, and it really wasn't until I started to work with people who had ongoing pain that it sort of popped up again. It's like, yeah, we've got the wrong language here, right? The purpose of the medication is to help the person do what they need to do to survive or have the best recovery. Yet we weren't telling people that. And I think it's a key piece that we need to shift all through, not just with the family practice docs, but through the whole of pain management. And along that line, to remember as well is that one of the worst kinds of pain is pain that is uncontrollable. So when a person has an injury, and during the beginning part of it, when the pain is really bad, one of the most powerful therapeutic things is to experience that the pain can be changed. And this becomes a problem, right? Because if we're going to take away the strong pain management at the beginning, the person could be left without the experience that the pain could be changed. And that could be, we believe that that's a driver of the sensitivity or the hypervigilance of the systems at times. So it's like there seem to be, we tend to shift way over to one side, and it's like, we don't, whenever we give medication, we're going to tell everybody it's for this, but to miss that there are some times when we would want the doctors and the medical system to give a different message.
Yeah, definitely. And I think just even the medications that we use and those opioids and the anesthetics, from a historical point of view, they've only been around for about 100 years, I think, 125 years, something like that. So we have a lot of evidence to support, that can make the pain go from a 10 to a 3 or 4 or something like that. But it still isn't really all that much time if you think about how to actually utilize that in an effective way. And I think the education that we're doing from a pain education point of view on how to utilize that medication, but also this is one part of the story. You also have your movements, you also have the breathing, you have the intention, and that the whole experience of pain is the combination of all of those different things that you're having at that time.
Absolutely. Well, and I think one of the other key things about it is that the research is clearly showing that opioid medication and pain medication can help to decrease pain, and yet a lot of the other things that we do can do that as well. So there's evidence that says that when we educate people the right way around pain physiology, that there can be a drop of pain. The evidence is pretty clear that change is best when we combine the education with movement. But there's also evidence that says that movement can decrease pain if we can do it the right way, which always sounds odd because most people come to us because it hurts to move.
Yeah.
Right. And so the idea that movement is the problem, but movement is also the solution seems really odd. And there's actually one of the statements in sort of yoga philosophy is that everything's medicine and everything's poison. So that the same thing, right? So if you move in a certain way, it's going to make the pain worse. But if we can get you to move in a different way, it actually can become analgesic. Mm-hmm. And one of the other interesting things that just has come to me in the last year or so, and it just come to me, patients have told me this enough times that it actually got in, which I think is something that doesn't always happen for us. So this person had said to me, when my shoulder pain's not too bad, if I just put a hot pack on, when it's not too bad, it works. But when the pain's really bad, what I need to do is I need to get my whole body hot. So I get the bathtub filled up with the right temperature water, but I also need to put in Epsom salts, and I put on candles, and I put on some Enya music, and I do some aromatherapy, and I'll put all that stuff together, and now the pain gets better. And so what the patient is telling us at that point, and what people have been telling us for years around the same idea, is that a lot of times the best pain management is when we layer things together. Right? And I think that's another piece that is important for us as we continue to work in this area is how can we layer things together? How can we provide the right body-based therapy, and how can we provide the right education for more of a cognitive-based therapy? And how can we do other things that would actually change the autonomic nervous system in a certain way? And then to change the central nervous system, we sort of, when the pain's really bad, we may need to do all these things together and get the pain relief, and then start to take them out as the person starts to recover. Right?
Yeah, I think it's something that I've been realizing recently as well. And I just put on a 1 Day to Improve workshop a couple weeks ago, and it was the idea. It's my Rethink Pain workshop, but then after the first 2 hours, and the rest is just techniques. It's all the little techniques from doing an acupressure on your hands to the intention behind it, to diaphragmatic breathing, to using all of these different types of things. And I start off with telling people to practice this stuff, the individual skills and techniques, when it's a 1 or 2 or a 3 out of 10. And it's the same idea. Like in New Zealand here, you have the All Blacks rugby team. You wouldn't pick that team and then go right into the championship game. you would take a team and then have a full month of practices to see which players are going to work best in which positions, which plays work best. And then once you have that idea of, okay, these are the people we want to use in this way, then you'll play the lower tier teams. And then you work your way up until you get to that championship game. And that any single technique, that warmth, changing the heat of the body, any of those techniques can work individually, but you need to practice them in order to show that benefit. And that's where not only having the layers, but if you take those layers and practice them individually, then they'll be even more important and potent when you add them all together.
Oh yeah. Yeah. I don't tend to use, I think that's perfect using the All Blacks team. When I'm getting people to do this, I often say, all right, so I've just given you a breathing technique, and based on everything you've told me and what we've assessed here, I'm thinking it's probably going to give you some benefit. But you've tried it once and you said it didn't change much right away. So what I'd like you to actually do is practice it more often. And you may be thinking like, well, it didn't work. Say, well, how about if instead of trying to decrease the pain with a breath, what about if my goal was to throw this dart and get it in the center of the dartboard over there? Now, I've never thrown darts before. So if I throw the dart at the dartboard and I miss the dartboard, what should I conclude? And of course, most people start to get the humor of this, right? Is because if you do one of these self-regulation techniques and it doesn't decrease the pain, sometimes the thought is it doesn't work, or it won't work for me, or I can't do it. Which I guess there's some people who might throw the dart at the dartboard, miss the dartboard, and decide I can't do it. But mostly people would figure that you need practice. And then so what I would say is, all right, so it's hard for me to get the dart in the center of the dartboard. And it's also hard to change pain at times, right? It's a complex thing. And it's you've already told me that this thing doesn't change very easily. So it's going to take more practice, right? So to give people that idea, and then to say, so how many minutes a day and how many days a week and how many weeks do I need to throw the dart at the dartboard before it might get into the center of the dartboard some of the time? Yeah. And so it's a difficult thing to do, yet so are these self-management techniques at times. At other times you're going to do them and they're going to change the pain a ton and you'll be really motivated.
Hopefully. Yeah. Definitely. And I love that example. I'm definitely going to use that. It's actually, it goes in line with the All Blacks example, but in a very different way. And I like that. The last little piece with the All Blacks part that kind of fits with what you just said is if it is that 10 out of 10 pain, you can definitely use these techniques and sure, it might not work as much. If you're only using these techniques when it's a 10 out of 10, you're going to be missing that board quite a bit. And so that's, I usually tell my patients at that point that it's okay to use these techniques, but you got to take that championship game focus in order to improve the effectiveness of it. And that goes in line with the dartboard. You want to make sure that you're focused really hard. If that's the one that you need to get on that bullseye to get it from a 10 to a 0, well, you really need to focus. It's not just whipping it at the board.
Yeah, and the one little piece to the analogy, just to complete it for you, is that when it's a 10 out of 10, it's like trying to throw the dart to dartboard, but I say to people is there's this really big, hairy, scary monster right beside you, and he's got super sharp knife, and he's just running it around the inside of your ear while you're trying to throw the dart. That's the pain, right? Or we need to say that in a way that person's not going to feel invalidated by some sort of cartoon character. But the idea being that when we are under super stress, it's way harder for these techniques to work at first. And so if we go back to the All Blacks thing that you're talking about, is the longer you practice it, the better you'll be able to do it in a more stressful situation. Yeah. And that's, it's odd that even people within the healthcare world don't see self-regulation techniques in this sort of way. It's very much seen as if if the person tried a few times, it didn't work, then it doesn't work. Or, the person, tried going to see the physiotherapist twice and it hurt more when they tried to move. And so, physiotherapy doesn't work, instead of realizing that this is such a complex, sophisticated resistant to change issue that you probably need to practice more. You're probably going to have to morph what you're doing and try different ways. And I mean, I can understand for the person in pain why you'd want to step out after 2 or 3 times of trying something that didn't work, or it made you feel worse. Mm-hmm. But I always feel like us healthcare people should know better. Know that we're talking about something that change is possible, but it may just be that you're going to have to try a bunch of different things before you find it. Because maybe you need to give the person, they need to have the right pill and the right acupuncture, acupressure, and maybe some hot pack and some breath calming technique. And then when they do all that stuff, now they can move with more ease. Maybe it's something as complex as that, which I just got to say, the one other thing that is crazy about this is that a lot of people don't do that sort of thing because it seems too complex. Mm-hmm. Right now, so I've had talking to the doctors. One of them said to me, "Well, why do people keep on looking for simple answers?" And of course, what I want to say is, well, because it hurts, right? And you want the thing that will make the pain go away here and now. So we're always looking for that, and I think that's because it hurts. We look for that, but we need people, smart people, healthcare people, to provide us with some of that knowledge of this isn't a simple issue, and you're probably going to need to find a complex solution to help this get better at first, and then you can start to take some of the complexity out.
Yeah, and it doesn't help that when you're in that pain survival loop, that our thinking brain isn't really active. So you're going into seeing a physiotherapist and you have all of this pain, and then the physio is trying to explain something that just goes right over your head. Or that's where the unfortunate side of things where they'll leave saying, "Oh, the physio said it was all in my head." Well, right. In some ways, if you say that in the right way, that brain is an output of the brain, pain is an output of the brain, right. Then it can make sense. But with that little bit of a tweak and interpretation and a bit of a, oh yeah, it's all in your head, well, then you're just one of those guys that's not going to be helping. So what do we need to do better in order to prevent that kind of a thing?
Wow. Well, when we're working with people, and if we're going to be talking to people about pain physiology and talking to them about the idea that pain is something that the brain or the human, however you want to say it, is it's a product. It's something that's coming out. Which the point of saying that is to get people to understand is that it's changeable. There's also to get people to understand that there is separation between tissue damage, tissue health, and the activity of the nerves in your body and pain. So these things are connected, but they're not directly connected and linearly connected. And so we're trying to get people to understand that idea. And so there's a couple of things that I think are important when we're trying to talk to people about. These are our broader views. Mm-hmm. One is we need to stop trying to convince people that they're wrong. So, and I think this is really key, is that we all have thoughts about pain. And until we sit down and think about what we think about pain, we tend to consider pain as being Lorimer and David say, like a health meter, right? That if I have this much damage, I'll have this much pain. And when the pain goes away and the damage goes away, they'll go together as if they're directly and completely related. But we've all had experiences in life in which they're not. But as a health professional, when you're faced with someone who's got beliefs about pain that don't match up with what our current understanding about pain and pain management is, and beliefs that will get in the way, what we want to do is we want to change that person's belief. And the harder you try to do it, the more you mess up, and the more the person doesn't feel like you're on their team, the more the person believes that you think it just is all made up or it's not real. And so part of our job in working with people, however we're doing it, if we're trying to get them to understand pain in a new way, what we're trying to do at first, I think, is create curiosity, or provide people with knowledge that they can think about. But to recognize that if I sit in front of you and say, well, the doctor showed me, my MRI, and I could see the disc bulge, and he pulled out the spine. He showed me about what a disc bulge is. And, so the reason I have pain is because I have this disc bulge. And as long as the disc bulge is there, the pain's not going to go away. So that's that direct link. Mm-hmm. And so you and I know that that's not quite right. But if I say that to you and you decide you're going to pull out a study to show me that you can have disc bulges that have pain, what you've done at that point is set me up to move away from you, not to move closer to you, right?
Yeah.
And I know Lorimer and David say really eloquently about the idea that what we try to do is use, when we're educating people, is to use metaphor and to use story.
Yeah.
Because when you use metaphor and story, what you allow in the situation is you're giving a person this thing to think about that's disconnected from the pain and self for a moment, right? So here's what I think, and I tell you this, here's what you think, and I tell you this story that gets you to think about this. And then as you're thinking about it, you start to realize, oh, that's not really consistent with what I was thinking about what was going on. And so it gives you the opportunity to consider it, right? And you can go away and consider it. Now, I guess we have to jump back to one of the other things you just said a few minutes ago, was this is really hard to do when there's a lot of pain.
Yeah.
Right? But I think one of the other things is that one of the other powers of story is that if you can talk to people about this idea from a story base, it's a lot easier to engage in a story than it is to engage in learning new facts, right? So when we're, even when you have a killer headache, somebody could be telling an engaging story and you might still be able to pay attention to it. But if they start to rhyme off facts, mm-hmm. right, then it doesn't sit the same way. So I think part of what we, go ahead.
Oh, I think what from my perspective, what sums that up nicely is entering that model of the person, entering the person's model of the world. And that even though your beliefs might not be matched with theirs and theirs might not be matched with yours, it's how do I enter their model of the world and engage them in a way through stories and through the language so that they can look at changing their model. And then from a patient perspective, just even being challenged of what is my model of the world and how is that affecting me?
Yeah. Well, I think one of the other things we've been trying to do is we've been trying to talk people into new beliefs or to changing their view. And one of the biggest things that we're trying to get people to understand is that even though the tissue health may not be normal, it's possible to still regain more ease of movement, get back to life more. And so this is one of the reasons why I really like the movement aspects of physical therapy, but also why I really like yoga, mm-hmm. is because, and the idea is that in yoga, you may be able to come and see me in yoga because it's more accessible, because it costs less than to see me as a physical therapist more times. And so if every time you come to see me, I provide you with an experience, a movement experience that's inconsistent with your previous determination about how dangerous it is to move or how much pain there'll be when you move. And so if that's been what you've learned, right? When I move, it hurts, right? When I move, it hurts a lot. If I can get you to come and see me a whole bunch of times, anytime you come and see me, the experience you have is that you could move more with less pain. I don't need to talk to you. I don't need to educate you about that. I don't need to tell you that this is possible because you just experience this possible. And I think this is one of the key things around pain education that is a bit problematic, is that a lot of us are trying to talk the patients into change rather than thinking about how do we give a person an experience. So you give experience through story and metaphor, but you can also give them an actual physical embodied experience. Right?
Yeah. And when did you get into yoga? Has that always been a part of your life, or did that come in with learning about the pain education?
Well, I've had this fascination with meditation since I was a kid. Although I wouldn't have called it meditation back then. But when I was in university, someone said, hey, I used to go and sit at the lake and actually just listen to the sound of the waves, just focus my mind on the sound of the wave coming in. And I'd sit there and do that, and I loved it, right? It seemed a little bit weird. I didn't know anybody else who did it, but I do it, right? And in university, someone mentioned it to me, and it's sort of funny because I didn't tell people a lot about this when I was younger. because it just sort of didn't match up with other stuff. So anyway, there's always was that, and then it hadn't really done much about it. But then when I moved to Vancouver, there were a whole bunch of people I was running into who were there's much more yoga in Vancouver than the other places I lived in. And then as soon as I started working in pain management area, I tried yoga classes a few times. And to me, there was this massive similarity. Like all these different things we were trying to do in the pain management programs were to try to go in every door. What treatment could we do to the person? Could we use movement? Could we use hypnosis? Could we use breathing? Could we use mindfulness? The cognitive behavioral therapies. So we're trying to go in every way. And I started to realize, well, yoga practice, at least the yoga practice that I was doing, was very much like that. Not all yoga practices like that, right? Because a lot of yoga practices are about one breath technique and one movement. And I was drawn much more to the yoga practices that include the broader expansive yoga that include things like mantra and which are affirmations and meditation and different things like that. Anyway, so it would have been the late 1990s when I first tried it, and it just matched everything. And for part of me loved it. The reason I tried it and I loved it was a little different from what people were telling me. You're a physical therapist, you'll really like yoga. But when I went there, it was because they were thinking the really physical stuff, and especially Iyengar-based yoga, which is very alignment-based. But what I liked about it was you got to meditate while you're moving. And for whatever reason, that had never crossed my mind. Like I've always done lots of sports in my life and athletic stuff. And then there was this other sort of thing about meditation, but it never occurred to me to do them together. And when I got to yoga, it did, and it engaged me a lot. I love that.
That's awesome. No, that's it's so true. And I actually came at it from a different perspective, which is a good thing. Like with yoga, I've been doing it on and off for a couple of years, or a good 5 or 6 years now. And I was part of the group of people that I looked at yoga and was like, oh, I'm not flexible enough for yoga. And that's why I avoided it. I was like, oh, I'm not flexible enough for it. But then when we went to Slave Lake, it was my wife that wanted to go and do yoga, and she didn't want to go alone in a new place. So I then went with her. And I just found that just by going with her and just doing it, I've felt much more calm, and I improved my flexibility. And I realized that even just the act of doing it is beneficial. But then if you bring in that intention and that mantra, and you really just fully engage in it, the benefits are even much more than that. So if someone is new to yoga, what is different from, say, your approach in instructing for yoga if they're in pain versus someone that's just the average Joe off the street wanting to do yoga?
Yeah, it's a great question. So I think the sort of simple way to start is that when a person is coming off the street into yoga, normally what we can do is we can teach them yoga. So we say, this is what yoga is. This is how you do it. Whereas when a person has chronic pain, what we want to do is shift from being a yoga teacher to more of using yoga as a therapeutic modality, to more of the yoga therapy. So what we're now looking at is the actual individual, how their health and their pain and their suffering has influenced them. So we'd be looking at how has it affected, we could start simply with has it affected your breath? How does it affect your body tension? How has it affected your posture? How has it affected your thoughts, your emotions, all these things? And then say, how could we apply the techniques of yoga to address how you have been changed by what's going on, or what's happening in you? So it's more it's more focused on the issues that the person has. With the idea in yoga as a therapeutic modality is that you can actually change any aspect of your existence through any aspect of your existence. So I've been injured, and I'm no longer confident that I can. I'm no longer confident in life, maybe, or maybe just in movement. And so, here's this person telling me this, and that sounds like a sort of a cognitive or psycho-emotional issue. And so, well, I'm a physical therapist, and so I can't start to do counseling around that. But what I could do is say, could we find a way to get you to breathe, or a way in yoga we would say to affect your prana or your energy that would change your sense of confidence? Could I get you to do something physical with your body that would change your sense of confidence or competence, right? So the idea would be is could we look at you in more ways? It's a different framework from which we start within physical therapy, right? Although a little bit with neuroscience, we start to say, well, what we learned in school is if you injured your knee, what we need to do is treat the knee, and that's how we'll get you better. What neuroscience would say is that, well, we could do things that would change your knee tissue, but we could also try to change the way the peripheral neuron is working. We could also try to work on changing the immune system. We could always also work on changing your spinal cord, your autonomic nervous system, your central nervous system. So there's like more doors. But within yoga, there's even more doors. That don't always match up with what we're thinking over in the physical therapy world, because we don't really talk about something like prana or energy or vital life force there. And we don't talk about peace and bliss and things like that over there as well. Mm-hmm. And so it's sort of where you start, but we also want to, when we're teaching people about this thing we put together called pain care yoga, which really is the integration of what we understand from science around pain, from the lived experience of pain, but also from pain management yoga, is we want to look at how does pain, what are the commonalities? So for instance, within yoga, there are techniques you would call mindfulness techniques. Although yogis didn't call them mindfulness, but that's what they were about. They're awareness practices. Mm-hmm. And so if you just came in and we were teaching that technique, the technique would probably last this long and you'd have to do it in a certain position. But what we would say is, maybe you can't tolerate that position. Maybe we need to put you in a place where we can calm the pain down better. Maybe you can't do it as long because you can't stay focused as long because the pain's dragging your attention away. Maybe you can't do it in that position because you're so sleep deprived by the pain that if we put you in that position, you'll be out in no time and not focusing on the technique. You sort of go on like that, right? Because pain changes in so many ways. So the practice of this pain care yoga or yoga therapy really is to look at how pain has changed the person, or the interactions between pain and all aspects of the person. And then think, how could we morph what we're doing to try to help that person help them with their physical body, help them with their breath, help them with even the idea of how pain can disrupt our ability to feel our body well. You can use many aspects of yoga around that as well. But then also helping people finding some peace. And I think this is very specific. When I started to teach therapeutic yoga classes, I started to see people much longer than I ever did as a physical therapist working in pain management. So, there we might see somebody for 4 or 6 months. But working as a yoga therapist teaching classes, there would be people who would come to my class and they would be there for a number of years. And I kept on hearing this message from people saying, the reason I like to come to your class is because I feel peace here. And one person said it so well. She said, everything that I was doing before, I'm doing now, but it didn't work until I actually found a greater sense of peace. All the things that she was doing in the past didn't work until she found that sense of peacefulness. So it's almost like she learned how to calm things down, but I think it was more than that. I think all those, the pain and how it disrupted her life, it created so much chaos and angst and all that stuff. And that trying to push forward in the midst of it, it wasn't working. And so she came to the classes and she would, while she was there, she wouldn't try to push to get better. She wasn't trying to get more flexible or more strong. She was, getting into the relaxation, the calmness, and the peacefulness that you can get in certain practices of yoga. And that there's that part of it was really, really important to her recovery. It is one of those things that I can't go to the research and find anything that would support this. Right. Most of the other things that we could do within yoga, I can try to find things that would make some sense over here in the science stuff. But I don't think we've really looked at this idea. And I think it actually is a reason. I'm starting to consider it more as a reason why some people can't get better well is because they're trying too hard, which I know sounds so contrary. But I think if all you do is fight, go ahead.
I was just I think you nailed it just with trying too hard or trying to heal. Like even the language around that and the word try implies that failure is possible. And some
True.
people, even just making a shift of I am going to heal, those people, when they come in and they tell you, okay, I'm going to get better, I just need you to help me with that. You know right away that they're going to get better. Versus those people that come in and say, oh, I've been trying this and this, and I've been trying this technique and these people, and I've been to all these people, and I can't stop the pain. Those are the people that I think what you're talking about would be really important, is just having that peace, that opportunity.
Yeah. The being part, right? Mm-hmm. You know, the thing that we get in mindfulness, and the thing that we get in when we become totally engrossed in that absolute sweet music, or, you know, sound of wind in the trees. I think that's part of the reason why for some people nature is the thing. You know, some people find that peace just by getting out in nature because they get consumed by the sounds and the smells. And again, I don't have the good language, and from the science side, from the yoga side, we would say is you're becoming present and you're becoming grounded, and you're starting to realize, you know, what's really important here. And to me, that's the exciting part of this, is just that, as you know, as I keep on going on, I'm learning new stuff. And, you know, when I listen to recordings of like talks like this that I did like last year or the year before, I think, oh yeah, I don't think that quite that same way anymore. I've, you know, learned this new thing because this is one of the troubles that we have, is we have not tested out a lot of our ideas with people who have ongoing pain, to see if it works, and, you know, if we can get an idea of who it will work with and who it won't work with. There's such commonalities that there are we can do this and it'll work for most people, but there's a lot of people that we need to morph it, right? And a lot of times the only time you know that you need to morph it is when you watch the person in front of you respond. And if we could circle back to one of the things that gets in the way of us being able to educate patients well, is that until you get good at this information, you're going to be so focused on trying to tell the people what you know, and you won't be focused on the person in front of you. And once you learn it well enough and practice it well enough so you can watch the people in front of you, you can watch when you need to morph, because you start to notice facial expression and body language. And I mean, I know some people get really good at not showing you all that stuff, but if they are trusting you enough to show you those things or respond, then it allows you to know, okay, the person's getting the wrong idea from what I'm saying here, right? And so you can, you know, go back and have a discussion. And it's it's the how-tos. So many people are learning what we need to do in terms of educating patients. But what they're not getting to yet is the how to do it, which is a much more difficult process.
Yeah, definitely. And that brings me to, I think we're getting near the end of our time here, even though I'm pretty sure we could talk for another hour easily. But I wanted to, within the Rethink Pain podcast, is talk about the one word of the year. And this is something that I did last year for the first time, for 2018. And the idea is there's a website, oneword365.com. And it's one word you can focus on every day, all year round, and one word that sums up who I want to be or how I want to live. And the idea is that it will take some intentionality and commitments, but if you let it, your one word can shape not only your year, but also you. And it can be the compass that directs your decisions and guides your steps. And my word for 2018 was evolve. Because we've talked about the education changing over time, and the word evolve to me means that change is inevitable, and sometimes it can happen really quickly, other times gradual. But by accepting and seeing that as my word when I came into a challenge or a new situation that I hadn't experienced before, well, I knew, okay, I need to evolve in order to fit this situation, to fit this patient experience, or some of the things that I've had to do personally, that like create this Rethink Pain workshop or get my black belt in Haidan Gumdo, the Korean sword fighting martial art. I've had to do personal evolutions too. So my idea is that each of the experts like yourself going forward, I want to bring in my word for the 2019 when this is podcast will be aired, and also have your input on what your word will be, and be about building this community in this word. And for me, 2019, my word is authentic. And I'm going with authentic because there's so much information out there. And like you just said about how focusing on what we know instead of that person right in front of you. And I feel like I have enough information and education right now that I can help many people. And the way that I can do that is being authentic and approaching each situation in an authentic and real way, telling my story and just listening to theirs. And I think that's, for me, going to help bring about the most change in the most amount of people. And it's, I think, my way of dealing with all of that information and giving it in an appropriate way. So what about you? What do you think, if you had to pick a word for the year of 2019, what would that be?
Well, the word definitely is alliance.
Nice.
And there's a lot of reasons for it. A lot of us who have been working in the area of pain management, we've been working sort of in our own sort of area. Of course that gets tiring after a while, but I also think that there's so much we can learn from each other. And part of what we want to do is step forward and put our unique aspect on things. And in doing so, we're differentiating ourselves from other people, but at the same time as differentiating, other people can start to think that you're not a collaborator. Collaboration has actually always been really important to me, but I realize I've been wrapped up so much in doing what I've been doing that I haven't, it's not that I haven't collaborated, but I actually want to find a way to collaborate more. That's important to me. But so it goes to there, and it definitely goes to the area of individual clinical work. And the idea that in school they tell us of this term therapeutic alliance, and they give us a little bit of understanding about it. But I think we have not really hit it very well. And just as an idea, there's a associated word that I'm playing with a lot is the word is co-regulation. So to quickly point out the idea is that I've been working a lot over the last number of years at teaching people how to do self-regulation practices. And then once again, in the past year, it sort of hit me one day. Someone said the word co-regulation, a word I'd never, the conjoined words I'd never heard of before. And it was like one of those smacks in the forehead. It's like, oh my Lord, I've been working under the pretense that everybody can learn how to self-regulate. And realizing at the same point is that in clinical practice, there are some times when I'm trying to teach a person how to learn how to regulate their breath or their body tension or their thoughts or emotions, and the person's struggling. And so typically what I would do is I would start to role model the same behavior, but at the same time as I start to build a closer alliance with the person. And I think this is one of the things that it's come to me. It's the stuff I need to explore more. And I've been talking to people saying, Neil, you need to go look at attachment theory and all that sort of thing. Because I think that there's a whole bunch of people who have complex chronic pain problems who need us to be closely attached to them for a while so that they can actually learn how to regulate and get better. And I don't have really great language around this, but I think that alliance is something that we really haven't looked at. And what we've been taught as therapeutic, especially as physical therapists, is you need to keep boundaries. You need to, not let the patient get too attached to you. But I mean, if we did that with a child who was really, really upset, we might never be able to get the child to calm down if we kept our distance, right? And so maybe it is that some of the patients we work with, we need to have a bit of a different view, is that to help the person learn how to self-regulate, we're going to need to figure out how to we need a different alliance with the person. And we probably need to, whatever this co-regulate, I don't really have a great definition of it yet or description, but you get the idea, right? Yeah. But the other thing around it is I think that it's possible with these two words is that some of the people we work with may never be able to self-regulate. And I don't think we've been talking about that. Is that some of us may need to continue to regulate in a group. Or maybe we need to find someone in our life who, when we're with them, then we can regulate this. Hopefully not someone you have to pay, right? So a friend you could hang out with, you can do this. Or maybe it is a Tai Chi class or a yoga class or a pool exercise class or something you need to do where you can actually, where there is an alliance that would allow you to calm things down best. And because physiological regulation is a huge need when pain's really bad. And I know a lot of the work that you do is around this, right? And I think this is really key is key for me because I haven't been thinking about it a lot, and it fits. This word alliance just has so many doors that I want to.
I love that. That is a great word. I think that especially with the stuff that you're doing with the doctors in BC and that alliance of putting all of those health professionals together. But I love how you also have that personal twist on using that word with your patients and building that rapport, that relationship in a way that what came to mind with me was neuro-linguistic programming, that the mirroring of someone's movement, if it's as simple as pacing the experience and blinking even in time with them, and then you blink and you notice they blinked. Oh, now you're leading, so now you can lead them to a better thing. There's so much very specific things when it comes into building that alliance. I think that is awesome. Thank you for that.
Oh, you're welcome.
So going forwards, I'm so excited to have you as my first expert within the Rethink Pain workshop. And what's going to go on is on January 19th, we're going to be doing a live webinar within the online Rethink Pain workshop. So that's where you're going to come and teach a bit more about yoga. You've already taught me so much about the idea of using it as a more of the therapeutic tool, but also that it's just a different lens to view the treatment and improvement. So I think I'm really excited about you teaching me and my community a bit more about yoga. Okay. And as part of that, you are going to give a 30% discount on your Yoga for Pain DVD, which is really amazing. So that'll be available for anybody who joins the online Rethink Pain workshop and checks out your recording at any time on or after the 19th of January. So I'm excited about that. So thank you very much for offering that to my community.
Welcome. Yeah.
And
well, we should just let people know that it's you can get it as a DVD, but we're actually going to give you a code so you can do it, so you can download it on your computer, so then you don't have to worry about shipping and all that stuff.
Right. And thank you for that, because I am used to the resources that I was when I was working with you before. You didn't have the online before.
That's right. Yeah.
Find that.
Yeah.
And so where can the audience find a little bit more about you?
Well, actually, I'm in a bit of a transition right now. So my new website is www.paincareu. So PAINCAREU, like the letter U.com. So paincareu.com. The website that I've had for years is lifeisnow.ca. This website is still active, but I've actually joined forces with a Canada-wide rehab company that has almost 200 clinics now. And so I'm working with them, helping to educate their people around pain and pain management. And as part of that negotiation, what they've done is they've taken over the Life is Now website, and we're going to use it to start to build more online resources for people in pain. So you still can go there and get the free online resource called First 5 Steps. So it has these introductory steps of some education about pain, a breathing technique, a body awareness technique, and a guideline for moving with more ease. And then we'll be There's another resource on there that's a paid resource called Pain Care for Life, and it has over 60 different lessons on pain management. And so lifeisnow.ca is where you can go and look at those. But the more current one that will tell you more about me is at paincareu.com. And that's where you can get the DVDs too.
Perfect. And I'm pretty sure, except for the most recent stuff that you've put out with the Pain Care U, I've listened and taken part in everything, and it's all great. So that's the one thing that I wanted to bring other experts in, because I know I don't have all the information. And even if I did, my teaching style and my approach might be a bit different and not approachable for everyone. So I'm going to encourage anybody listening to check out, and I'll put those websites and things in the notes for the show below too.
Yeah.
Perfect.
And that's fits with that alliance thing. But I think it also fits with the ideas that for your listeners who've got ongoing pain, keep listening to other people, because sometimes something that the two of us may have said, someone else may say it in just the right way, that it lands properly, that it makes more sense. And often we need that in the face of ongoing pain. We need to hear things in multiple ways before we can sort of figure out how to use that information.
That sums up our conversation perfectly. I think that's a great way to finish things off. So
Okay.
Thank you very much, Neil, for the chat today. And I look forward to working with you in the future.
All right. Thank you too. Good luck with all your work. And I'm happy I've started to look through Rethink Pain, going through it. I'm liking it so far a lot. So thanks for doing that.
Perfect. All right. Thanks. I hope you enjoyed that conversation. I had a great time chatting with Neil. Every time I talk to him, I've learned something new, and I hope that you did too. I'm so excited for January 19th. That's when he comes and joins me at the online Rethink Pain workshop in order to give a presentation about yoga. He'll be giving some of the basics so that you can begin practicing yoga right away. And you'll also get access to the 30% off when you join the online Rethink Pain workshop as well. So you can check that out at www.rethinkpainworkshop.com and scroll down to join the Rethink Pain workshop. Going forward, we're going to have this podcast being released every 2 weeks. So once a month, I'll be bringing in some sort of expert, and I have some amazing ones lined up, but we'll keep that a secret for now. And then every other week, so every second week, I'm going to be asking people who have overcome pain in their life to come on the show, and I'm going to interview them. So we're going to be going from asking health professionals about those techniques and the tools that they use to talking to the people that have actually used them. And if you have a story of overcoming pain yourself, then please send me an email at info@rethinkpainworkshop.com, and we can get that conversation started. In 2 weeks' time, I'm going to be the first person, because I have a condition called Miller-Hiostosis, and I've overcome quite a bit in the last 20 years of my life. But I'm going to do something a little bit special. I'm going to be bringing on a guest host, John Moran, and he has his own podcast, Pilgrim-ish, which is phenomenal, that he just started out. And he's going to be interviewing me. So it's not just me telling you my story. He's going to make sure that he gets to the nitty-gritty of what I've done and how it's worked for me. I also have a monthly live Rethink Pain workshop in Whakatane, New Zealand. That is at Pōwhakaaro, and the details are again at the website, rethinkpainworkshop.com. You can register online and come and show up. It's a donation towards Pōwhakaaro. So all of the proceeds go to the Pōwhakaaro because I wanted to have a community resource that anybody can access. So please, if you're in the area, come and check that out. I also have a 1 Day to Improve workshop on February 23rd. This starts with the Rethink Pain workshop, my core module, and then I go through just hours of techniques that I give the neuroscience behind it, and then we practice them right away. This is the second one I've done, and the first one was absolutely phenomenal. We had food from the daily grind, and it was so amazing. I have early bird prices on that at $125 until January 19th, and then it goes up to $175. So get in early on that. And that you can register at www.rethinkpainworkshop.com/p/1day. I also want to give a huge thanks to my cousin Evan Degenhardt for the absolutely amazing intro for this podcast and for the upcoming podcast as well. So thanks for that. Thanks to Alice C. and Carlos Rigo for allowing me permission to use their music from their new album. For information on how to find them or any of the other things from the podcast, you can check out the show notes. So that's everything. There's a lot of exciting stuff coming on. If you have any questions, send me an email at info@rethinkpainworkshop.com. And thank you for listening. Until next time, keep living and loving life to its full potential.